This presentation should help you with your discussion for this week because we're going to go over a lot of the points that you need to provide in terms of your discussion post. It'll also give you a good idea of how to start your health promotion program. No matter where or what setting we find ourselves in, any health promotion program needs support from top-level decision makers. And the reason for this is that they provide the necessary resource support for the program. There are some times when top-level decision makers actually do have the idea for the programs. And when this happens, it makes it easier for program planners because they don't have to justify the need for the program. Sometimes, however, the idea for the program comes from outside, comes from somebody different than a top-level decision maker. And when this happens, it becomes necessary to gain the support of decision makers before we even move forward with a health promotion program. It might not make a lot of sense because why would anybody think it's necessary to convince somebody that it's good to do this when it improves somebody's health? Well, the reason for this is that a lot of times decisions to develop new programs have to be based on a variety of different factors. This can include finances or other resources, policies, public images, and politics. And these are just a few considerations that have to be made at the same time that we're putting our idea for a health promotion program forward. Planners must understand that gaining the support of decision makers is actually one of the first and most important steps in the planning process, and it should not be taken lightly. Before planners begin to write a program rationale, they need to identify appropriate sources of information and data that they can use to justify program development. The place to begin the process of identifying this is actually through the literature. It can include looking at government publications, scientific articles, books, anywhere where there's scientific and well published evidence to support the program. In general, useful information and data in writing a program rationale include express the needs and wants of the population, describe the status of the health problem, show how a potential outcome of the proposed program aligns with what decision makers feel is important, show compatibility with the health plan of a state or a nation, provide evidence that the proposed program will make a difference, and show how the proposed program will protect and preserve the single biggest asset, which is people. Although many of the types of information and data are generated through a review of the literature, there's also other places that we can get this data. Information and data that describe the status of a health problem within a population can be obtained by analyzing epidemiological data. Epidemiological data are available from a number of different resources, including government agencies and health agencies. When a rationale includes economic component, it is often reported based on a cost-benefit analysis. A cost-benefit analysis of a health promotion program will yield the dollar benefit received from the dollars invested in the program. In contrast, cost-effectiveness analysis measures the cost of a program based on health outcomes achieved. A common way of reporting this is a return on investment, which measures the cost of a program versus the financial return realized by the program. However, when we talk about public health, we might not be able to provide an ROI in a year. It may take 10 years. Helpful tools have been developed by the Center for Disease Control and Prevention that could help you estimate return on investment. A fifth source of information and data is evidence that the proposed program will be effective and make a difference if implemented. By evidence, we mean the body of data that can be used to make decisions when planning a program. This data can come from a needs assessment, knowledge about the causes of the health problem, research that has tested the effectiveness of an intervention, and evaluations conducted on other health promotion programs. When program planners systematically find, appraise, and use evidence as a basis for decision making when planning a health promotion program, it is referred to as evidence-based practice. And this is what we are moving towards. A Guide to Community Preventative Services is a resource within your module this week, and I highly suggest you look at it because it will help you in terms of developing a rationale. After we have gathered the data and looked at it, next we need to title the rationale. And the third step after we title the rationale, we will go over in more detail in the next slide. Next, we want to write the content. The first paragraph or two of the program rationale should identify the health problem from a big, global, or macro perspective, whether it's international, national, regional, state, or local. In other words, begin the rationale by representing the problem at the most macro level for which supporting data is available. Showing the relationship of the health problem to the bigger health problem at the international level and/or the state level is the next step in presenting the rationale. The next portion of the rationale is to identify the health problem that is the focus of the rationale. This declaration of the health problem is actually referred to as the problem statement, or the statement of the problem. It should begin with a concise explanation of the issue that needs to be considered. The statement should also include why it is a problem and why it should be addressed. If available, the statement should also include supporting data for the problem, including what could possibly happen if the problem isn't corrected. Some of this data may actually come from a needs assessment or a community health assessment if it's already been completed, or from related literature. In presenting the problem statement, it could be helpful to use social math. This is defined as the practice of translating statistics and other data so they become interesting to a journalist or meaningful to the audience. In other words, data, especially large numbers, are presented in a way that people may find it easier to understand and then support. At this point in the rationale, you have to propose a solution to the problem. The solution should include the name and the purpose of the proposed health promotion program, and a general overview of what the program may include. Since the writing of the program rationale often precedes a much more formal planning process, the general overview of the program is often based on an educated guess or best estimate, and that's okay. Next, we have to state why the program will be successful. This is the place to use the results of that evidence-based practice and that data and analysis to support your rationale. The final step in creating a rationale is to include a list of references used in preparing it. Having a reference list shows decision makers that you have studied all the available information before presenting your idea. Once we've developed our rationale and shared it with stakeholders, we want to start considering who's going to be on our planning committee. The number of people involved in a planning process is determined by the resources and the circumstances of the particular situation. Identifying individuals who would be willing to serve as members of the committee, which is sometimes called a steering committee or an advisory board, becomes one of the planner's first tasks. Because an effective planning committee is usually composed of interested and well-respected individuals, it is important to establish it carefully. When organizing a planning committee, it is advisable to consider the concept of partnering to meet the eventual goals of the program that will be planned. Partnering can be defined as the association of two or more entities working together on a project of common interest. Such associations usually mean sharing of resources and tasks. There are a number of reasons to partner that include meeting the needs of a priority population, sharing of financial and other resources, solving a problem or achieving a goal, bringing more stakeholders to the process, bringing more credibility to the program, working with others who have the same values, seeing and solving a problem from multiple perspectives, and creating a greater response to a need because there is strength in numbers. In looking for partners or collaborators, planners need to consider who is interested in meeting the needs of the population, who sees the unmet need of a priority population as a problem, who has the available resources and could help solve a problem, who would benefit from being your partner. These are all questions to consider. Once the planning committee has been formed, somebody has to be designated to take the lead. The leader, or sometimes chairperson, should be knowledgeable about the health problem being addressed, familiar with the community, have respect for partners, and be capable of leading a group through a planning process. One might think that this is easy, but this is not always an easy task. So you have to be very thoughtful in who you select as your chairperson. Once the planning committee has been organized and a leader is selected, the committee needs to be well organized and well run to be effective. It should meet regularly and have a formal agenda for each meeting and keep minutes of meetings. Also, the committee meetings should be efficient, energizing, and productive, and represent a good use of committee members' time. In addition, it's important for the committee to communicate frequently, both with decision makers and those in the priority population. When we talk about some of the parameters for planning, we'll get to that on the next slide. Often, committee members must identify planning parameters within the planning parameters within which they will work, and it must be agreed upon. There's a number of questions that should be considered when we think about formalizing our planning committee for our health program. The first is, what are the philosophical perspectives on the program? What are the values and the benefits of the programs to the decision makers? Do they see the programs as something important, or is it seen as extra? Next, what type of commitment are decision makers willing to make? Are they interested in the program becoming institutionalized, or are they more interested in providing a one-time or pilot program? Next, what type of financial support are decision makers willing to provide? Does this include personnel for leadership? Does it include equipment, space, materials? Another question, are decision makers willing to consider changing the culture? That is, decision makers interested in establishing and supporting a health culture, are they willing to support this for a whole community? Will all individuals in the priority population actually have an opportunity to take advantage of the program? Or is it only going to be available to certain subgroups? What type of committee will the planning committee be? Is it going to be permanent or ad hoc? What is the authority of the planning committee? Will it be an advisory group or a programmatic decision-making group? After the planning parameters have been defined, the planning committee should understand how the decision makers view the program and should know what type of number and resources they can expect. These are all things that we need to think about when we're developing a health program. You're not going to go so far as to developing a committee, but these are questions that you should consider when you're thinking about your health program and what you're going to implement. Here are the references for this presentation.